Okay, so I think you can go. So hello everyone. My name is Erwan Calvier. I am the founder of Vytruve, but I am also CPO, and I continue to see 60% of my activity patient. Because of this, I can also improve and test everything in Vytruve development and so on. So thank you very much for joining the webinar. Feel free to ask question. We are in live. I have a chat, and so you can ask a question, and I will answer a question during the live. So feel free to ask question. So during 45 minutes, we are going to talk about 3D scanners, about software, about Vytruve, about VTF tool, and I'm going to show you how you can do a transfemoral socket with Vytruve with the VTF tool. So we are going to talk to all of this. If you have question on scanning part, if you have question on software, really don't hesitate. I'm here for that, and everybody is here also for that. So to begin, it's really important to say that the CPO job is really demanding. You know, I live this. It's necessary to manage many things during the daily life. It's necessary to manage patients. It's necessary to manage technical part, doctors, also a trip to go to rehabilitation center and also emergency. So it's not an easy job. It's really not an easy job. And you also know that a success of a prosthetist depend on a good clinical exam and casting, a good modification depending on the clinical exam, and also a good alignment with the manufacturer requirement. So it's three important things to have a success during manufacturing a socket. So now let's go to the transfemoral topic, because we are here for that. And it's you know, a transfemoral socket, it's really not easy. You know, during transfemoral casting is necessary, you know, to have the ischium, is necessary to have the lateral part. Sometimes it's complicated for the patient to be stand up, and for the first patient, when they don't have a transfemoral socket, it's also complicated for the patient to feel the ischium. So it's complicated for the CPO, and it's also sometimes complicated for the patient. And if you are CPO, you know, you are like this. It's really not easy, and it's that's why we have developed the tool I'm going to show you. Another important thing also, you will see that Vytruve is not a transfemoral by measurement, is not a transfemoral with a library shape. So it's really a transfemoral with the scan of the patient. For example, for me, I continue, as I told you, I continue to see patient, and I really want to have the stump of the patient, the shape of the patient, and not a library shape. So for this, as I told you, we have developed a VTF tool. The VTF tool is this tool. So I'm going to give you a brief description. So you have so two tools, a right and left, to do the casting for right and left patients. On this tool, you have a base to adjust the ischium gland height with the measurement here. You also have 4 wings. Each wings have a specific shape, and you can see this here. And each wing have 3 stickers, and 1 stickers have a hole. You will see why it's important just after. So your patient, you can put your patient on a tool directly in charge of ischium, and also with the lateral part already on your patient. For ring, I can be tightened with the BOA system to adjust. So to show you this, I'm going to share a video of the using of the VTF tool. So I'm going to share my screen to show you this video. Okay. So share screen. Okay, do you see my screen? Is it okay? You can tell me in the chat. Yes, it's okay. Okay, perfect. So to do a transfemoral socket with Vytruve is necessary to use two scans. Scan with the tool and a scan without a tool. So I'm going to show you. So you will see now how I will position the VTF tool on the patient. So I tightened the wings. I position the ischium directly on the patient. I tighten the wings. I adjust the height ground. And I can ask to my patient if he feel the pressure of the ischium. And after, I will position my pen through the stickers. And you can see that my patient is directly on the ischium, and I also have the lateral part, you know, here already adjusted. And you know what is really nice? You know, I have time to do the casting because my patient is directly on the ischium. You know, he can sit down and stand up. So I have time to do the job, and I have time to adjust the VTF tool and to do my scan. So I scan my patient with the tool. So to scan, it's just 3 minutes. I have everything. And after, I will do a scan without the tool. So one scan with the tool, one scan without the tool, and you will see that Vytruve will merge both scans. So you are going to see just after. So what is really important for the first step is to have an accurate scan. It's a really first step. For this, it's also necessary to have a color scan. So with Vytruve, we propose a scan for the patient, but you know, transfemoral socket, and if you want to have a very comfortable socket and very accurate socket, it's not possible to scan, you know, with a mobile app or with an iPad, because it's not as accurate to have the stickers and everything. So first time, the scan is very important. I'm going to share my screen again to show you the results of scan with tool and scan without the tool. I'm going to answer some question I have in the chat. So I'm going to show you scan, and after I will answer to question. Okay, so scan with the tool. With Vytruve scan, and you have this quality, you know. So you can see that we have colors. We can also read here if you want the liner, and we have the ischium part just here, and already you know, the lateral part already okay. And now without the tool, here, you will have this quality, you know, with the 4 punches here, it's the hole through the wings, here, here, and also here. So I stop to share my screen. I'm going to answer the question. So we have a first question. Does the space in the socket simulate the knee position, or there is another ID for this space? So so what is really important with the VTF tool is to have the upper part of the socket, you know. So it's the ischium position and also the lateral part. What it's under 20 centimeter, it's the scan without tool will be the most important thing. In a second version of VTF tool, you will have a possibility to adjust the flexion, the flexum. So if the patient have a flexum, for example, you can also use the VTF tool. It's really not a problem. We have another question after scan. Are you going to take measurement as well for modeling part? Yes. So, you know, in a transfemoral socket, it's also necessary to have a pressure on the limb. So during the scanning part, you are going to take measurement, and after, the job will be to apply your measurement directly in the software. So I'm going to show you to show you this. So as I told you, really important, the scan, and also to do a very good clinical exam. So it's a basic, but I really think that CPO will stay CPO, and CPO won't be replaced, because it's necessary to have a comfortable socket to do a good clinical exam, and it's the job of the CPO. So what we want with Vytruve is to give the CPO the perfect tool to do the job, but it's necessary to determine the good suspension system, to determine where is complicated for the patient, to also do the fitting. And I really think that it's not the job of the CPO to spend much hours or many hours to do the job in front of the computer. I really think the job of the CPO is to see patient, to train the patient, and also to take care of the patient. And it's not possible to put one engineer behind each CPO to do a socket. It's necessary that the CPO do the scan, the modification, and the alignment by himself without 3D skill. So we are going to see it. So how many size do we have with the tools? So with tools, you can scan all the patients. So you can see here, you can scan also a very big patient, or also, you know, very small patient. So with just one right and left, it's possible to scan all patients. For the Ramus support and so on, it's possible to do it directly on the software. So I'm going to show you this. So with the patient, what scan with the tool? What scan with the tool? You can also put measurement on your patient, and we also put some diameters. I have another question. Can we do scan for pediatrics? Yes, it's really not a problem because it's scan with the tool, scan without the tool. So the tool can scan very small patient, but it's also the scan without the tool, so you can scan everybody. So now we are going to go to the modification part. So I'm going to open Vytruve. So I will share my screen here. So here you are in Vytruve software. In Vytruve software, you can write all the patient measurement, and in a patient folder, you will have the general information, measurement of your patient. You can also change it. You can also determine the foot. So here we have more than 150 foot, for example. And you can also determine a knee. So we often add knee in Vytruve database. You can also determine a locking system if you want to add during the modification. So, as I told you, scan part is very important. So when you click here, start a scan, you will determine why you want to scan, for example, on a liner for a socket, and you will have a real checklist about everything to miss nothing. For example, if you want to scan your patient, you will preparing your scan. You have some information here, and you can click here. Scanner calibration. You can have also your measurement sheet just here. It's possible to add seals if you want, or to add measurement. And we are going to, take care of everything during all the process. So it's for the scanning part. And after, when you will click next, the scan, you can do your scan. So, as I told you, to scan, one with the tool, one without the tool. So to merge both scan, you can click here, clean. And you will follow a path with the tool, without the tool. And so you are going to do it now. So it's the scan with the tool. First step is to position, stickers. Green, green, green. Yellow, yellow, yellow. Here it's a red, here and here, and the blue just here. Here, here, here. So I confirm and I continue. So scan without the tool. Here you can, cut the scan if you want. And you can also remove seals. Here I have the seal. I can click right draw, and you will see that Vytruve will remove the seal to do the rectification. So I can continue. And now I will position. I told you that one stickers as a whole, and I will say, okay, the yellow is here. Here it's the red one. Here it's the blue one here. And the green is just here. And I will click confirm. And you can see here that I have my scan with the tool and my scan without the tool. You can see this here. So with the tool, without the tool, and the transfemoral tool just here. And now when you are here, it's possible to adjust by yourself all wings like this. So I can adjust, if I want, the position of the rings. And when it's okay, I can click OK, I can confirm, and you will see that Vytruve will merge scan with the tool and scan without the tool. So it will take few seconds, and at the end, you are going to have both scan merge, but the rectification will arrive after. So it's just the merging part. So yes, alignment, we arrived just after. We have a question directly on the chat. So we are going to wait a minute. I hope it's okay for the scanning part. One with the tool, one without the tool. You position your patient directly on the VTF tool. After you scan without the tool, and scan are imported directly on the software. So you will see the results. So other question. So for instance, okay, so it will be possible to change the rotation of the ramus in 2 weeks. So here, you can see the results of the merging. So now I will position the ischium, anterior axis and posterior axis. Okay, and I confirm. And now you will see that my positive is like this: anterior, posterior, lateral, and medial. And now I will begin my modification. Create a socket, and now you are going to find all the steps you do directly at the workshop. It's the same process. So it's not necessary to learn another job for the CPO. So here you have your positive, and here it's your socket. Here it's a measurement sheet. So first step, I'm going, so you can reduce global. You can also blocking area to avoid to reduce on bone area. And you can also reduce by your measurement sheet. First step, I'm going to put the 0.8 on the positive. It's here. And I can apply, you know, it was the measurement sheet I took on my patient. You can apply directly your measurement sheet. So you will see that the shape will be automatically applied. So here I will click apply, and you will see here that my socket will change. So you can see that here it's my measurement sheet just here, and I can here. So I have my circumference, and I have also here my mediolat measurement and my anteropost measurement. And I can also, you know, move my measurement. When I'm here, I can also, you know, add or remove material. For example, here I will add 5 millimeters here. You will see just here 5 millimeters. And if you are here, we can see that it's this percentage. So it's not necessary to modify many things on the top of the socket because it was done with the VTF tool and directly on your patient. That's why it's very nice, because the job you do directly on the patient is the job you don't have to do on your positive. So I will remove this one. So for me, the shape is okay. I respect my measurement sheet. So now I can go to smooth. So if I have, you know, if I want to smooth the shape, I can smooth here. Here, my shape is very nice. So you can see here that the shape is very nice. So thickness. For a transfemoral socket with Vytruve, the best thickness is 5 millimeters. So you will have a socket 5 millimeters, and you can use with a patient with more than 120 kilograms. So here the socket. And now I'm going to continue and to go to flare. So flare, it's also a nice tool because you can change the shape of your positive. For example, I want to change here this part. So you can see here I can have a diffusion, and I can also do an offset. You will see the result on the right part, just here. So it's to do a flare, or if I want to open a little bit the ramus just here, I will determine, you know, the ramus part just here, the blue one, and I will do an offset just to open the ramus part just here. You will see. So here I can open it, and if I want to do a flare to the lateral part, I can play with the orange part and, you know, determine directly, for example, 5 millimeters lateral part just here. You will see the result directly here. So it's okay for the flare. If you want to position a shutter lock, so for this ceiling liner, it's not necessary to position a locking system, but I'm going to show you this. So yes, for the ML and AP, I have a question on the chat, so that's why I stop. So we have a question: can you measure ML and AP? So I will show you this. When you come back in reduction step, if I go here you have AP and here and here. So the measurements are just here to adjust and to do the perfect modification. So you can continue with shutter lock. If I want to find a shutter lock system, for example, this one, OC1, my shutter lock is here. First, front position. I can adjust the front position. Second, rotation in the front position. And you will see that directly I have the shutter lock to the right part of the screen. Sagittal position. Sagittal rotation. And at the end, the locking. It's how we can, so if I want, for example, to put this one, it's the same here, front position, front rotation, and you will have, you know, directly on the socket, the distal pin. So I will remove it here because it's not a pin lock system. Okay. Now next, here, you know, the alignment table. So as I told you, you know, the alignment system, it's a really important step of the prosthesis, and you know, sometimes it's doing by the technician or it's doing by other person, and I really think it's better if it's a CPO who do this part. So when you are here, it's possible if you want to change a knee directly here. Maybe 3R. So it's possible to change a foot if you want. So Elan, for example, when you are here, you can adjust the flexum. You can also adjust like this. And when you are here, also like this. And you have directly the 4-hole plate who will be created at the bottom of the socket, and the foot are already aligned by the manufacturer. So you are sure that the foot is already aligned, and also the knee, because we had imported the knee regarding to the manufacturer recommendation. So here you have your socket, and when it's okay, you can click here and finalize your order. So in the chat, so it's possible to put a key system. So today is not possible, but if you are customers, we can integrate a key system. It's really not a problem. So we manage all our development software, so you can integrate a system if you want. So it's the end of the socket. So you have seen that we have merge scan, we have reduced the volume by the measurement sheet the CPO have done on the patient. We also have add or remove materials, scoop and recharge, also small, do the thickness, do the flare, also shutter lock if it's necessary, and we have also align. So now you can export and print by yourself if you want, but it's also possible to order directly to Vytruve production center, or you can also buy Vytruve 3D printers. So I'm going to stop to share my screen. So for the 3D socket, so you can print, the size of the socket. So with Vytruve, it's possible to order or to print by yourself very big socket, and you have every time the same thickness. So you have the alignment part. You have done directly on the software by yourself, and you have here 4-hole plate to connect your knee. So it's really a check socket. So you can modify it. You can adjust. You can modify it. You can send it. You can put form. So you can do everything like a classic check socket. It's really not a problem. So you have seen all the process. You have seen the scan part, modification. You also have seen how you can order the socket. So what I want to show you, it's the CPO who will do it by himself. It's really the CPO who manage each part, because I really think it's important. For example, for me, I am a CPO. I really want to do this part by myself to be sure that everything is great, and for my patient, and also for the comfort of the patient. So I'm going to read question directly on the chat. Is it possible to print definitive socket? So yes, it's possible to print definitive socket. So you can do your rectification. You can export your STL file and print your definitive socket. So you can choose to work with a check socket, or you can choose to work with a definitive socket. You can do what you want, but you do the modification, you do the scanning part by yourself. Do you have, so now I can answer to question directly on the chat. And maybe I can show you how we can modify the socket. So if you have 2 minutes, I'm going to put airgun. It wasn't plain, so I'm going to put a airgun, and I'm going to modify the socket in front of you to show you how we can modify directly the printed check socket. So please let me 2 minutes, and I come back with a socket, and I'm going to modify it directly in front of you. So I come back. aller chercher. So, I think everybody knows this tool. So I want to show you that it's real check socket. And so you can do the job on the software, but it's also necessary sometimes to do it on the patient. So I'm going to show you this. And you know, so So you can really modify your check socket, and it's necessary also for the patient to have a very, very good socket at the end. So I have another question. Can you export the shape before you apply lock and alignment for the all plate adapter? Yes. So if you have, for example, just the socket, it's big and you don't have space, to put the whole for or plate, yes, it's possible to export the socket and to do the alignment also by yourself. Can we design mass, subluxar or quadrilateral socket? So you can, scoop and recharge. You can modify with the flare. You can do many things. So it's possible to adjust the shape to do what you want and to have the socket you want. So is it possible to do without a silicone liner? Yes, it's possible also to do contact socket. It's possible to put directly, the stump of the patient directly, in the socket. So yes, it's possible with liner, without liner, what you want, you decide what suspension system you want. It's possible to do socket with seals. We have seen it. It's possible to do a locking system. It's possible to do contact socket. So what you want. So which material is being used for check socket? So it's PETG. It's the same when you use thermoforming, for example. It's PETG, so it's the same for 3D printing. So that's why it's possible to modify it. That's why it's possible to send it, and that's why it's possible also to stick foam during your fitting. So another also very interesting things for a check socket like this. You don't have carbon fiber or you don't have Scotch cast. So you can directly modify at the end of the socket without problem. So your patient have a pain just here. You can hit it and modify very easily without problem, without carbon and so on. So is it printed with FDM technology? So yes, check socket. For check socket, we used FDM technology because it's the only way to have a really modified check socket or socket. So that's why we use FDM technology. So for check socket, FDM technology, and for definitive socket, it will be SLS technology, or also a mix of SLS and also carbon fiber. Is uniform thickness to the socket? Yes, for check socket, it's uniform thickness for because when you want to have a check socket, it's necessary that your patient can work during 2, 3, or 4 months with the socket. So the best way is to have a uniform thickness. And also important thing, to have uniform thickness, you can modify the socket where you want. And if you adjust, 2 mm thickness, when you want to modify the socket will break. So that's why it's uniform to have to put the patient in security, and your patient can work during 2, 3, or 4 months or 1 year sometime. What factor influences durability and need for replacement? So what factor? It's the same. It's always the stump of the patient. For sometimes the stump change, so it's necessary to change it. Sometimes, I don't know, there are many factors for this, but it's also another interesting things with the software. So if your patient has the socket, you have designed Vytruve, your patient after 1 or 2 months wear 1 or 2 socks, you can open Vytruve software, you can reduce by 2 1 socks or 3 socks, and you can print again the socket without, and your patient keep the check socket. So it's not necessary to bring back the socket and to do a transfer, and so he can keep the socket, and you can print another socket and put directly on your patients. So thank you very much for all these questions. It's very interesting. So in case of hot water country, so yes, so in some country it's complicated to have silicone liner or polyurethane liner or so on. So it's also possible to do socket with foam. So for this, you can print a socket, you can do a foam, you put the foam in the oven, you put the foam directly on the socket, and you can put a bag of sand directly on the socket, and with it the foam will go to the socket, and you will have a socket with a foam inside to avoid to use liner or silicone liner or so on. So what is the thickness for the socket? So for a Vytruve TT socket, it's 3 to 7 millimeters, depend on the patient. For TF socket, with a 5 millimeter thickness, you can thread all the patient, and if your patient is, for example, 125 kilograms, it's not a problem. 5 millimeters socket is really great. So, for example, your patient is under 125 kilograms. You can also, at the end of your fitting, use Scott cast. It's really not a problem. It's the same for a classic check socket. If you want to reinforce the socket because you want that your patient, for example, go in a mountain or so on, you can reinforce it. But we guarantee the Vytruve socket during 2 months for a patient of 125 kilograms. So PETG is transparent and translucent. So here you can see, so it's not very clear on the scan, but you can see, you can, write directly on the liner and see where it's necessary to modify the socket. Okay, what is the average printing time? So a transfemoral socket, it's between 15 hours and 20 hours. It really depends on the size. So sometimes it's 10, sometimes it's 20. So it's really depends on the size of the socket. But what is really so I'm going to give you real things. So, last week I saw a patient. I saw my patient at 3 p.m. I do the scan. Okay, I talk with the patient. I I drink a coffee and so on. I do the scanning. So it was 3 p.m. 3 p.m. and a half, everything was done. So scan was okay. I put the computer and I do my modification. And at 4 p.m., everything was sent. So I come back home, I spend time with my family, and the day after, when I arrive, at the company, I took the socket and I tried the socket directly on my patient. So that's why it's very interesting, because 3D printers will work during night. So, time, it's not real time, because it's time during night, it's time during weekends. So you can do another thing. And another also important thing, if you have Vytruve printers to do the check socket, your technicians are focused on definitive socket. So they can do the definitive socket and they don't spend, 4 hours to do a check socket. So, what kind of post-processing required for final socket after printing? So, for a check socket, no post-processing, because you take the socket in the printers, you just send a little bit, here, but when the socket will be finished, it will be with the trend line. And for the definitive socket, it's depend on the technology. It's depend if you use FDM, it's depend if you use MGF or SLS. It's depend if you use TPU, if you use PA12, PA11. So it's really depend on the technology you use. But with Vytruve check socket and with Vytruve 3D printers, it's not necessary to have post-process. It's, you do your scanning, you do your modification, and after you print your check socket, and after you can fit on your patient. It's really plug and play, And what is very nice, this process give you much time for your patient. So if you have much time for your patient, you can listen to them, and you can also have much time for you to be able to take care correctly to your patients. So do you have other question? So really don't hesitate. I'm here. We are in live. So don't hesitate. We still have, 8 or 9 minutes. So for example, in my CPO life, Vytruve changed many things. Because I can have much time for my patient. Technicians are not focused on check socket; they are focused on definitive socket. So they can do silicon calendar. They can also do carbon fiber, and they are not always thermoforming. And another important thing, when you use Vytruve 3D printers, or when you use Vytruve production center, you know that your socket will be delivered in 2 or 3 days. So when you leave your patient, you can tell to your patient, okay, I will try the socket tomorrow. I will try the socket in 2 days. And, it's not necessary to call the workshop. So it's possible to do the socket because my patient will go on holidays. Okay, you can, have a repeatability time, repeatability quality, and also a digital tool is very nice for train the new CPO, for train young CPO, and also, to do a very, very good socket because you have time, because you are better. So there are many, many advantages of digital, of Vytruve, but the main important thing is without 3D skill. Sometimes for me, I do my modification on a train. I do my modification, when I am on holidays. So you can do your modification everywhere. You have seen it directly on the computer. So does it break during eating? So, I modify, and now it's very strong. So no, when you modify it, it's normal. It won't break. How do you scan between legs? So, when you scan your patient, it's sometimes complicated to have between legs. But, with the VTF tool, you will have the good shape because wings will do a compression. So the scan can see inside leg. And without the tool, when you put your scan like this, or if you have a small hole, it's really not a problem, because when you are going to merge both scans, the job will be done even if you have a small hole and if the scan is not okay between legs. So it's really not a problem. Yes, so for the guarantee, when you use Vytruve production center, we guarantee the socket during 2 months. So if you have a problem, you can print a socket again and it's free. If you have the 3D Vytruve 3D printers, it's the same. You can do another socket, but if you print by yourself, it's not possible to guarantee, because it's you print by yourself with your printers. So thank you, Denis. Denis, it's a customer, so we are very happy to have Denis here. So hello, Denis. So yes, yes, it's possible. So at the end of the webinar, you will have a link to see the webinar again, and we are also going to share the link directly on LinkedIn. You can also add me on LinkedIn. So it's not possible. You will find the link at the end of the webinar, or also on social media if you follow Vytruve. Yes, so don't hesitate to show to your colleague. Don't hesitate also if you want to contact Vytruve. I put all the contact here, so it's possible to contact by WhatsApp. It's easy for you. Email, or you can also go to Vytruve website. Vytruve website, you will have many information of everything with video, and also at the bottom a small chat, and we can exchange. So if you have questions, don't hesitate. All team are here. And another really important thing, it's our custom services. If you have a question, if you have something, you will have a very good custom services. And it's really important for me as a CEO to give you the best custom services. So I will check question. Will FDM printing socket bear stress? So I really don't understand this question. So it's possible to explain a little bit more, please? So thank you very much also for all the questions. I'm really passionate by patient, by CPO job, by technology, by 3D scanners, and so on. So thank you very much for all these questions. It's a pleasure to exchange and to give information. And if you have advice, or if you have another point of view, you can also contact me. We can organize a video conference to exchange, and so it's always a pleasure to exchange with everybody. So now it's time to close the webinar. Thank you very much for everything. So thank you very much for the questions. Thank you very much for everything. and so I stay available, and all Vytruve team stay available for you, and to change also the way you do prosthetics. But the main important thing is the comfort of the patient, and it's really important that a digital tool like Vytruve go in this direction. So thank you very much, and have a nice morning, evening, and bye bye. Thank you.